Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the drugs for metastatic prostatic cancer. The prostatic cancer is the most common male cancer by incidence, that is the new cases in a year, and the second leading cause of cancer death among the old population in the male. Prostatic carcinoma range from very indolent lesions, which are being increasingly managed by active surveillance, to lethal disease that requires definitive therapy. So this is a cancer of the male, especially the older individual, most common male cancer by incidence, but the second leading cause of cancer death. First leading cause of cancer death is the lung cancer. Okay, so it is a cancer, but it goes little slowly. This is the prostate cancer here. This usually happen around the periurethral area. This is the prostatic part of the urethra. Okay, this is the periurethral area. That is the site of cancer, and cancer may go to other organs or body parts. That is called metastasis, like this in the vertebral column, the lumbar vertebra. It may go to the sacrum, ilium, pelvic bones, other pelvic bones, as well as to the ribs and the thoracic vertebra. But lumbar vertebra is a common site, and these are actually osteoblastic growth. New bone grows around the seedling of the cancer cell. This is not osteoclastic, rather osteoblastic. Okay, so we got the prostatic cancer, and a common site of metastatic prostate cancer. Okay. So what are the drugs for metastatic prostate cancer? We have two types of drug, like the androgen receptor antagonist, like Flutamide, Nilutamide, and Diethylstilbestrol. These are potent anti-androgen. These are non-steroidal competitive androgen receptor antagonists. We have also Leuprolide, Goserelin. These are gonadotropin releasing hormone agonists. What they do, this Leuprolide, Goserelin, they suppress the gonadotropin secretion, desensitize the receptors in the anterior pituitary for the luteinizing hormone and also follicle stimulating hormone, especially the luteinizing hormone, reduces the production of testosterone. The androgen receptor antagonist, when combined with long-term gonadotropin releasing hormone agonist, therapy, so when they are combined together, is highly effective. It will be highly effective if we combine this and this. This is androgen receptor antagonist. This is gonadotropin releasing hormone agonist. They are combined together to get the high effectiveness of the therapy. We have another drug, Diethylstilbestrol. This is an estrogen. This is not very much popular nowadays because of a lot of adverse effects. It also inhibits the endogenous androgen, so it decreases the testosterone secretion and also blocks the production of luteinizing hormone. Okay, so we got that. So drugs for metastatic prostate cancer like Flutamide, Nilutamide, Diethylstilbestrol, androgen receptor antagonist are taken orally. Leuprolide, gonadotropin releasing hormone in prostate cancer, is equivalent to the orchiectomy. Okay. So if we go to the initial part of our treatment, common treatment, if it is localized, there will be watchful waiting. If it is radical, radiotherapy may be required, still it is localized. Radical prostatectomy is required, the cancer is localized, but in case of metastatic cancer, we need the androgen blockade, like bilateral orchiectomy. We take out the testis out, both the testis, and we can use the luteinizing hormone, releasing hormone analog, okay, and bilateral adrenalectomy. These are the treatment modality. It depends on the physician or surgeon how they will manage the patient and what is the stage of the patient's prostatic cancer. Okay, so we got that. The prostate cancer, it is periurethral cancer. Metastasis mostly in the lumbar vertebra, maybe in the thoracic vertebra, even to the rib, even to the pelvic bones. Okay, we got that. The commonly used treatment, always there is some modification depending on the surgeon. Okay. So we got the Flutamide, Nilutamide, Diethylstilbestrol, this androgen receptor antagonist taken orally. Leuprolide in prostate cancer equivalent to orchiectomy with regression of tumor and relief of bone pain. Leuprolide is available as sustained release preparation, as subcutaneous preparation, as an intramuscular injection. Goserelin, this is also a gonadotropin releasing hormone agonist in prostate cancer, is equivalent to the orchiectomy too, with regression of tumor and relief of bone pain. Goserelin is implanted intramuscularly. Gonadotropin releasing hormone agonist can result in surge in testosterone during the first week, but then testosterone level will be decreased to the orchiectomy level. So this drug, all the drug, those are used in metastatic prostate cancer, has adverse effects. Adverse effects of Leuprolide and Goserelin, these are the gonadotropin releasing hormone agonists, cause impotence, that is failure to erect penis during sexual activity, hot flashes, tumor flare, especially initial few days. Okay, so loss of libido, there is the desire or drive for sexual activity. Adverse effects of flutamide, nilutamide, and bicalutamide antiandrogen that causes gynecomastia, gastrointestinal distress like diarrhea, loose motion. Flutamide particularly may cause liver failure. Nilutamide may cause visual problem. It may damage the vision, especially the retina. Diethylstilbestrol, that is an estrogen product. Estrogen is ethyl estradiol. That is also an old therapy for prostate cancer, but it is not very popular nowadays because we have other alternate drug. It causes impotence, again failure to have sufficient erection of penis during sexual intercourse. Gynecomastia, enlargement of the male breast, thromboembolism, myocardial infarction, MI, stroke, cerebrovascular accident, and hypercalcemia. These are the adverse effects of diethylstilbestrol. Okay, so we know that diethylstilbestrol is also contraindicated in the female. If the female during pregnancy take diethylstilbestrol, then their children will develop blue cell carcinoma of the vagina and uterus in the early life. Okay, we'll not go there. So diethylstilbestrol for prostate cancer in the male is not very popular. Diethylstilbestrol is largely replaced by gonadotropin releasing hormone analog like Leuprolide, Goserelin. Okay, and that's all about the pharmacological treatment of the metastatic cancer of the prostate cancer. Okay, so if you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel, please subscribe me. Have a nice, wonderful and blessed day. Bye now.